And I have heard most of the patients, especially patients who have kidneys who are around 1.2 to 1.5, 1.8, they talk about some medicines that they get, especially the herbal supplements. And they tell me that, that causes, even I as a doctor face this. People have advised me that if you take these herbal supplements, the creatinine level comes down, and you would be free of the disease. So would you tell our viewers that how good is this advice, or would you wish your viewers or your patients to take this advice?
So when I was in Chennai, Apollo, you may be aware, many people across the country used to come to Chennai, at least in the 1990s, because facilities were not available all over the country. We used to say every patient who comes to Apollo Chennai also goes to Vaniyambadi. Vaniyambadi is a small town near Chennai where Unani medicine was being given for kidney disease. So your question is very relevant, and it is a problem in this country that there's a lot of indigenous medications available, and many patients do go. In fact, I believe more than 50% of the patients do take these medications. Let me share my perspective with you. Kidney disease has many causes, and each cause has a different treatment to depending on what is happening inside the kidney. If somebody comes to me and says, my doctor has told me my creatinine is high, I would first like to make a diagnosis of why the creatinine has gone up. So creatinine raise does not mean a single disease in the kidney. I can think of 22 different diseases which can present with a raise in the serum creatinine. Once I know what is the cause of the disease, I treat the cause. It is very similar to somebody has a fever, I do a blood test. The blood test tells me the patient has typhoid or malaria. I treat the typhoid or malaria. I don't treat the fever actually. Similarly, kidney disease can be caused by 22 different reasons. I find out the cause and then treat it. None of the indigenous medications actually do find out the cause. They give medicines just to reduce the serum creatinine. To my knowledge, there is no medicine to reduce serum creatinine because serum creatinine is an end product of our metabolism in the body, which has to be excreted in the kidney. If there was a medicine for serum creatinine reduction, there would not be a department called dialysis because everybody can get that. So I believe if a patient comes to me, I can give some medicine after knowing the diagnosis and it can be treatable. Another patient comes to me, there is no medicine there because the kidney is already chronically damaged. So there could be patients who have gone to a indigenous medicine specialist, taken a treatment and improved. As we know, many of these indigenous medications also contain steroids. I have had several
Yes.
patients go take medications and improve because they have been given steroids in the form of indigenous medications. We have actually checked it in IIT Chennai and found that these medications have steroids in them. So it is not what is the medical specialty that you are being treated with, but what is the drug that you are using. If a disease is responding to steroid, whether an indigenous practitioner uses it or I use it, it should be responding. So I just wanted to draw your attention here, the importance to diagnose what is the underlying cause of your disease. It is not the creatinine that I'm treating, it is the cause of the disease that I am treating.
So,
Sorry, Shubha, you want to take it?
yeah. You have a question, Jaya, regarding
Yeah,
this?
so Doctor, I wanted to ask you, how does one get to know with respect to the bodily changes, how does one know that there is onset of kidney failure? What are the typical symptoms? If you could please talk about that a bit.
So before we go on to the typical symptoms, we should understand, as I already told you, even 60 to 70% drop in the kidney function, there are no symptoms. So first and foremost, our countrymen and women should understand, please make yourself know, are you at high risk? If you are high risk, without any symptoms, every year the following test will be done: serum creatinine, urine protein, blood sugar, hemoglobin, and blood pressure reading. If any one of them comes abnormal, we should start looking at to taking care of it. As far as symptoms, as I already told, they come very late, but the symptoms are decrease in urination, which is again a quite late phenomena. When somebody comes with decrease in urination, they may also come with some swelling in the body. Initially only in the lower extremities like legs at the end of the day, but then slowly progressing to all over the body. Usually, this decrease in urine output, swelling of the body is also associated with people finding that their urine contains a lot of protein. How is it picked up by a layman? When a layman goes and passes urine into the commode or into the toilet, they will find there's a lot of frothing coming out of the urine, just like you have put some soap into the water. So this frothing of urination is because of the protein that is leaking in the urine. Equally important, when somebody does not have any swelling, decrease in urine output, is excessive urination. Kidneys usually take your blood and make urine of around 1 to 1.5 or 2 liters of urine per day. One of the things that kidney does to the urination is to concentrate the urine. So one of the features can be lack of concentration of the urine. Thereby people have large amounts of urine. So they will think that they are passing so much of urine, it is not a disease or it is not a symptom of kidney disease. But one of the things that we always ask our patients is, do you wake up in the nights to pass urine? Somebody after 50-year-old waking up at night is very normal, but somebody at 20 getting up in the night multiple times is definitely a feature of kidney disease. Apart from this, blood pressure not coming under control, several other things like bone pains, skin changes, all of them can be a feature of kidney disease. But most important would be drop in the urine output, excessive urination, waking up multiple times in the night, frothing of the urine, uncontrolled hypertension, and certain skin changes and changes in the bones in the form of pains. But please note again to emphasize, kidney disease is asymptomatic till almost you reach remaining 30% of the kidney function only.